South Louisiana, and health educator for Fox 8 News. Graduated from Tulane Med School, Tulane residency, long ago when I had hair, over 30 years ago, and that's my story, and I'm sticking to it.
Hey y'all, Kaita Mutepfa, representing Kaita Mutepfa. So how else you know Kaita Mutepfa? That is not her on this panel today. So I tell people all the time I'm a mom, I'm a daughter, but I'm a taxpayer in Louisiana. And I access my health care here in Louisiana. So I look forward to sharing some of my realization journey and the things that I've experienced, and so grateful to be on the panel with all these people that pay for all this education.
Hi, my name is Claire Smith-Williams. I am a registered nurse. I've been a nurse for 24 years. I graduated from Dillard University. I started my career in ICU. I worked in ICU for 10 years. I worked in PACU, I worked in endoscopy, and for the past 12 years I've been working in liver transplant here at Ashland campus. I'm also a mom and a proud wife. So my dear friend.
It's all right.
Good morning, everyone. Sorry for my tardiness. My name is Janice Walker, physician assistant here at Crescent Care. I am a graduate of Southern California University. I'm originally from California, but it is a pleasure to be here on this panel today, and I'm so excited of what we're about to talk about today.
Question is, what does self-advocacy look like in healthcare to you guys?
So, Tia, repeat the question for me. What does self-advocacy look like for you? So I think oftentimes as patients, we go into a space expecting for people to have the answer for us, when the reality is we have the answers ourselves. Like, it literally sits in our gut. You know when you feel something, you know when you haven't done something, you know when your physician has said, I really need you to follow up on this, or I really need you to do this. That to me is self-advocacy, listening to your gut self and then being able to project that. Now, you may not know the terminology, anything, right? But Dr. Griggs always talks about how to take something that's complicated, do that translational science, and make it make sense. Google it, ask people about what's going on, being able to walk into a healthcare facility and say, you know what, no, I don't want to take another medication. And so a little bit about my own personal health trajectory. January 2020, I was at a retreat in Atlanta, and I knew I was sick before I left New Orleans. I was afraid. I still got on the plane. When I got on the plane, I knew that my blood pressure was elevated. I never had high blood pressure. When I walked off the plane onto the runway in Atlanta, onto the walkway, paralysis set in. So in my early 40s, I had 4 strokes. My MRI still indicates the damage on my brain where the strokes occurred. Again, I had no prior history of high blood pressure, but I had stress. I had internalized everything. I, worked in an industry where health insurance wasn't an issue, but I was afraid. I was afraid of what it would look like. And so having to be in Atlanta at Emory Hospital where no one knew me, I had to advocate for myself. I had to say, okay, I know what's going on. I'm afraid to articulate what's going on, but I still need you to guide me through what's going on. And from there launched an entire health trajectory of knowledge. And the biggest thing that I learned is that I didn't listen to my body. I didn't listen to all the signs and symptoms that told me to sit down, to go get tested, to take the medication, to do this, to do that. I wanted to just keep going and going and going. And how many of us in this room just keep going? How many of us in this room were at the Kiki ball last night and still showed up today. Hello. I knew damn well, Jay Christopher, I shouldn't have been at the Kiki ball until no 1 o'clock in the morning. My body cannot wake up at 6. I can't do that, right? However, I'm here to make sure that people understand that that advocacy part is really listening to your gut self and then being able to articulate to other people and to make sure that they do not listen. They are not the expert of your body. You are the expert of your body, right?
So I think that kind of deserves some applause. Just to continue real quickly, the self-advocacy piece is a collective self. If we go to a restaurant celebrating an occasion, we pay a lot of money for that meal, and something's wrong, we're going to speak to a manager. And we're not leaving until we speak to a manager and get an answer. Exactly. It's the exact same thing for us as patients. All of us, whether we have degrees, whether in medicine or not, we are patients at some point. And you should not leave your doctor's office until you have your question answered. If you want to think about it, I'm going to give you a visual. When my grandmother would come and sit on the edge of the bed with her purse on her arm, saying, I need to go to the school because of you. I don't know what they talk about, Mom, I'm about to go to bed. We need to go to the school and talk about what you did. Now, of course, after I got slapped in the back of the head, we would go to the principal's office and she would sit there with her purse on her arm. And what else did he do? And a lot of times I wouldn't have done anything. I'm not leaving until you explain to me what he did, what the circumstances are, and why this happened. It's the same thing with our bodies. Like Kaita was saying, I try to take the complicated and make it simple for you, for us, because we are, like she said, the experts on our body. Do not leave that doctor's office until they explain it to you in a way that you can understand. And the way in the house I was raised in, if I couldn't explain what I was learning in med school to my 8-year-old sister who learned about long division that day, and explain to her what I learned, say, well, baby, you can't explain this so she understands it, then you must not know it. So don't leave that office until you talk to a doctor or somebody that can explain to you before I leave what's going on with my body. I'm not leaving. Well, I don't have to leave because I don't understand you. Are you saying that you're going to be liable if something happens to me? Because I don't understand what you're saying. You're telling me to take a pill that makes me sick. I get dizzy. I'm not non-compliant. I keep telling you that pill makes me sick. I feel like I'm going to vomit. I'm not going to take it. There's nothing wrong with that because there's a billion other pills and other ways to treat it. So self-advocacy is that, and if there's nothing else you can remember my grandmother slapped me in the back of the head and looking at me like this and sitting with her purse and not leaving until she understands.
I think it's really important to voice your concerns in a way that a provider is able to understand you. And it's also a provider's job to be able to communicate what I've learned and express that to you, because as a provider, it's a partnership and it's a relationship, and you should feel like you're in a relationship with your provider. You should trust me to convey what I have to convey to you, and you should be able to convey that back to me so that I can make a good decision and tell you what path works for you. So if you're telling me something does not work, you have a right to decline anything. You also have a right to understand those risks that come with declining that, because patients tend to forget that everything has a risk and a benefit. So make sure you understand both sides. Doctors will say, hey, just take this, but everything has a risk. So when you get your prescription, it will come with a long list of everything. Yes, it also comes with a benefit, so don't forget that's a benefit, but everything comes with a risk. So just make sure that this relationship, you're trusting the person that's telling you, hey, I know this is a long list, but remember that I'm guiding you. And if you trust that person and they're able to explain, like you said, you were sick, your blood pressure. If I'm explaining to you what elevated blood pressure does to your body, what your liver, your kidney, what the long-term consequences of that is, then a headache For a week, when you first start taking your medicine, may not make you say, I'm gonna quit. It may make you say, look, I had a headache. Is there something else we can do? Yeah, let's work on this, because to me, the goal is to get you to feel better in the end. But you have to have a trusting relationship, and that's part of advocating for yourself, is ensuring the provider that you talk to is also on the same goal, has the same goal, is going to communicate that effectively to you, and is going to make sure that the next time you see me, I'm gonna ask you, hey, did you take it? How often are you taking it? When are you gonna take it? What are we doing next? What's your lab? Because every time you see me, unfortunately, I cannot give you the answer immediately, but we're going to get to the answer. It may not be immediate answer, but it will be an answer.
I got a quick question. Suppose this relationship ain't working.
Then you have a right to go to a different doctor.
I can fire you?
Yes, immediately. I may not work for you. Every doctor is not going to be for every patient, just like every relationship is not for everybody. I am a straightforward provider. I'm going to tell you what it is, and everyone does not like that. And that's okay. And I will tell you, if you feel like I'm not working for you, you're welcome to get someone else. But I can assure you, every patient that's under my care, I care. So I may not say it the way you like me to deliver it, but I'm going to care. So you may find someone that may hold your hand a little more gentle than me, but they may not care. They're just telling you what they need to do, tell you to get you out in 15 minutes. So you can pick which one you want. So that's a part of advocating. Pick who you like. Don't pick who's telling you the truth. Because a lot of doctors, unfortunately, will smile but get you out in 15 minutes and you have no idea what's going on. So it's important to say, hey, did this person tell me what I want to hear, or did they tell me the truth about my health?
I agree with everyone. As a patient, for me, it's about accountability to myself. What am I doing for myself? How am I taking care of my health? Just like the young lady said, if I'm not taking care of my health, how do I expect for someone else to take care of me? I'm the first person. I have to look at myself in the mirror when I wake up each and every morning. So before I go to my provider and I bring all my problems to my provider, what have I done for myself? What have I changed in my life to make my health better? Again, a lot of people think we Jesus. We're not. We're not. When you walk in, we don't have a cure for you. That's not what medicine, that's not what the healthcare system is about. We're here to assist you in your health care. That's what we're there for. And again, like this lady said, we're here to tell you the truth. We're here to tell you the truth about what we see, about the results, about the research that we have studied over time and continue to study to make healthcare much better in the United States of America. That's what we're here for. But we're not here to take all of your problems away. We're here to tell you what we see, what you present. Again, I'll tell my patients all the time, if you need a second opinion, go get one. If I don't have it for you, go get what you need to hear. A lot of them come back and say, you know what, they said the same exact thing that you said. But if somebody has a different solution for you, go for it. This is all about your body. This is all about what you want to accomplish with yourself. Now again, when you come to us and we give you the information, it's up to you to do something with it, not to just sit on it. So get understanding when you go to your doctor's office. Make sure your expectation is a realistic expectation when you go. Not something that we're going to be able to cure your hand as soon as you walk in the door from 10 years of pain that you have endured. But something that we can work on. If you work with us, we will work with you. It's a process. Everything is a process. And we're here to help you, not to harm you in any way.
Self-advocacy is basically like taking control, of your own health. And just like this young lady said, you know your health better than anybody else. You know your body. You know when something's wrong. I've had situations as a patient to where my blood pressure went up. They said it was like 130, 140. My blood pressure runs like 90. My blood pressure runs low. So the first thing they wanted to do was prescribe something for me to take. I went to the emergency room because I wasn't feeling good, but they wanted to prescribe something for me to take. And I'm like, something else is going on. This is something, if you look at my records, you can look back and see that my blood pressure has been low. And 130 for me was very high, you know, compared to like my mom. So it's really just, you know, taking care of yourself, knowing yourself. I had to tell them, you know, and I never go into a doctor's office or emergency room saying I'm a nurse or anything like that. But, you know, I had to tell them, no, this is not, we're not doing this. Something else is going on with me, because I know myself, I know my vitals, I know, you know, my body, and something else was happening. I think it's also important, what you two guys said was, you know, it's like being in a relationship. You know, you have to find the provider that works for you, you know, and that's part of the self-advocacy. You have to find the person that works for you. Now, I work with maybe 6 or 7 doctors, and they're all good, but they don't mesh the same with all patients. So I think just being able to choose, you know, your healthcare team and know, you know, what works for you. Some people need the tough love, and some people need a little bit more hand-holding. But self-advocacy is definitely one of the biggest and most important parts of healthcare, for sure.
For this one, so my next question is, what are the questions we should be asking to our providers for self-advocacy? How can we be showing up and be present for ourselves? What are the important questions we should be asking?
The very first one when you walk in the office is, can you look at me? Can you put your phone down, and can you not look at your computer? Can you look at me? Because we're trained to start the evaluation from the minute you walk in the room. Is your gait off? When you smile, are you smiling to one side? When I shake your hand, is your hand cold? If I give the doctor's handshake, do I feel a pulse that's irregular? The bottom line is, this is a relationship. Just like, and again, don't be afraid to say, look, I'm sorry, it's not you, it's me. It's me. Can I have my records, please? I want to try to see what else is out there, because this ain't it. But the first question is, can you focus on me?
Right.
Well, I definitely agree. Start there. I would say next would be, you know, I always give the vital information. Patients don't always ask vitals. You don't know your baseline of anything unless the provider gives it to you. So what's my blood pressure? What's my weight? What's my normal BMI? What's my normal labs? And am I late on immunizations? And what's your baseline of everything? Your kidney function, your liver function, because you can't know anything's abnormal if you don't know what your baseline is.
Real quick, will I be seeing you again, or am I going to see somebody different every time? Are you a student, or you?
Oh no.
Am I going to be seeing you?
You will of course always see me, unless you see a different provider. My organization is 2 of us.
Particularly in OBG, when you.
Oh, in OBG, I would agree.
Are you gonna start with me, or are you gonna finish with me? And if they call, this baby decides to come at 3 o'clock in the morning,
Who's delivering it?
Are you gonna deliver my baby?
Yes, in OBG, who's delivering baby for sure. In primary care, I don't know, every organization's different. Yeah, I would definitely, you could ask who's going to be your routine PCP to make sure you see the same person. At my clinic, it's 2 providers. You're only seeing us 2. You're primarily seeing the one that you initiate with. If not, you're going to see the other one if you're sick, just because you can't guarantee you're going to see anybody. So that's the guarantee you get in when you're sick. But yeah, I guess you could ask that. For me, we don't have that problem. We're only seeing me or my associates. So yeah, I guess if you're at a large organization like Oshner,
Hey. Easy now.
I mean, I'm at a small site.
Like she said, I'm in primary care too. So when you come into our office, you're going to see me as well. You're not going to see anyone else. But this is what I ask: how may I help you today? Even though you've given us your complaint, how may I help you today? So get ready to tell that provider what you've been going through, everything that has happened that has led you up to that visit today, or your concerns. You know, sit there and observe the provider, just like the doctor said. Make sure that provider is listening to you. Make sure that a provider is attentive to you. And just give the information that you need to give. I'm a person who listens. That's what I do. I sit there and I listen to everything that you're talking about so we can come with a solution. Then I ask you, is this plan okay with you? If this plan is okay with you, then we will move forward. Do you have any other questions or concerns that you would like to address today? So make sure you are ready. People come with a list sometimes when they come into the office. Come with your list of things. Their provider will say, okay, well, we can't address maybe these issues at this time, but then we can address some other issues at another time, because some of them do not correlate, okay? But make sure you are ready and prepared to give your story.
Yes.
So, you don't have to raise your hand. I don't want to put anybody out there, but the majority of us do not go to the doctor annually, right? The majority of us do not go to the doctor annually. We go to the doctor when something is wrong.
Yes, so sick.
And one thing I like to emphasize to folks, because sometimes we forget, that Louisiana is the only state in the Deep South below the Bible Belt that had full expanded Medicaid since 2015. I'll say that once again.
Yep, that's right.
Louisiana is the only state below the Bible Belt, or in the Bible Belt, below the Mason-Dixon line, to fully expand Medicaid. What that meant, what the Affordable Care Act said, what it enabled us to do, is that no matter what your situation was, this was an opportunity for you to go into for preventative care. And oftentimes what happens to us, especially in the Black community, is that we wait. And we wait. And we wait. And we wait. And so the question, which I can't, because y'all just said you can't fix it. You said it so much. But one of the things that we don't do as a Black community is say, well, what if I don't follow your advice? What will happen to me?
Exactly, risk versus benefit. Yep.
What if I don't get my blood pressure checked? What if I don't leave the job that's stressful? What if I don't tackle systemic racism? What if I don't go to therapy? What if I don't get a divorce? What if I don't go to therapy with my kids or move out of that neighborhood that is a trigger for me? What if I don't? Oftentimes we don't do that. And I know my doctor, who is a Black woman, she said to me many times, no matter what I do, Kaita, it's not gonna change the head-heart connection.
Correct.
So until you make a decision to change, and I can only give you things to assist. Yeah, the pill can help you, yeah, the meditation can help you, yeah, the other things can help you, but at the end of the day, you have to make a conscious decision. And I really want to elevate and thank Ms. Doreen and the staff at Crescent Care, Glennis, Tiana, because to do something, first of all, this is the first Black Health Summit, am I right, Chris Donis, that I've seen in the city of New Orleans. In New Orleans, right? I know Dr. Griggs does a lot of different things and different initiatives. However, in terms of just bringing everyday folk together, everyday folk from, and Crescent Care is bold. They some bad mamma jammas because they got other healthcare providers out here too. You know, shameless plug from one, I ain't gonna say where she worked. However, oftentimes we don't ask and advocate for ourselves. What if I don't follow? What if I don't do? What if I don't take my meds? Right? My history is in HIV. What if I don't do what I'm supposed to do? What will happen? Right? And so being able to ask that question and then sit and wait for the answer. Because their answer may require you to do some really hard stuff. Like when they say come back in 2 weeks after you've taken your meds, you gotta come back in 2 weeks. No, 2 weeks. They've prioritized you, right?
Yes.
So yeah, being able to ask the question, what if I don't follow your advice, then what?
I really don't have a certain question that you should ask, but I just want everybody to know, I know it's simple, but there's no dumb or stupid questions. Like, I think that whatever you're feeling, you know, whatever you feel like you want to know, whatever you don't understand, some patients come, you know, to clinic and they don't even know why they're there. You know, they're like, well, you know, I got an appointment in the mail, you know. So I think, you know, just, you know, ask questions, and don't be afraid of the answer.
And also, don't think lying is not gonna come through in your blood work.
I appreciate you saying that.
You had a pack of bacon last week, just saying. Extra crispy in the air fryer.
I appreciate you.
Yeah, don't lie, because y'all will be like, really? You ain't took not one blood pressure med, girl.
Okay, at this time, I am gonna open up questions. If anyone has any questions for anyone on the panel.
I have a question.
Okay, I'm gonna speak with this young
I'm a
lady.
patient here at Crescent Care, and that's how I found out about this. But I guess my question is like, okay, let's say like the relationship with your doctor that doesn't work out, you need to find like a new doctor. How do you go through that process of finding a new doctor, or like any advice of like how, I guess as like a Black person, how I should find a new doctor?
The way I feel is, like I said, I work with a group of doctors. I think speaking with your nurse can kind of help you as well. I have moved some of my patients around. I have, you know, a lot of patients, they don't want to say, oh, I don't really like Dr. blah, blah, blah. I don't want her to get mad or him to get mad, or, you know, but, you know, they didn't explain this to me. I feel like, you know, or they were kind of rough, or, you know, different things like that. I think if you have, you know, a good nurse that you can speak with, you know, they can help to guide you as well. You know, if there's like a group of physicians or providers.
Yeah. So Black Mutual Aid, and what I mean by that is just each one ask one. A lot of times, like for example, during COVID, my daughter and I delivered food to elderly and homebound people. And this is the person I called when I was delivering food, and I was like, this person is sick, what do I do? We're doing consultations through the door, right? Or, and I always have to shout her out, Dr. Veronica Gillespie, because before when she was serving people when I was her patient, and then she had to leave to go do something else to impact the field of medical care, I had to say, who do I go to for this, and this, and get those references from them. And I would say just leverage people in this room. That's the beautiful thing about Black doctors and nurses and healthcare professionals. They will share with you, or they'll even ask you, what is it that you're dealing with? What is it that you want to confront? And you'll end up finding somebody just from asking that question to them. I would also equally ask people that may be aligned with healthcare. Right, pharmaceutical reps, you got Chris Donna, Chris, raise your hand, yep. You have folks in the room that know other people throughout the entire state of Louisiana. That could be a connection as well. But leverage people in this room.
And see, using those channels, you can get into those popular doctors because it's more of a relationship and appeal. Well, I call the clinic and it's full, but you called the auntie? Oh, well, I gotta take that. Look, just come on. And we take for granted a lot of us in this room up here take a lot for granted. African American doctors, at most, there are 5% of all the doctors in the country. 5%. African American males are less than 3%. There are only 50,000 total out of all the doctors, but we take it for granted because they've been knowing me since they called me Rabbit when I was 4 years old. So we take for granted, and they know all my peers and friends. So reach out before you leave. The first question to ask that doctors, do you have anyone you would recommend? I just want to hear it a different way. And if they're rude and they say no, that's when you go. Nurses make the world go round.
Yes.
My godmother was a nurse. And they teach us medicine. Nurses and social workers and teachers. So just ask those people if you can't, but this is a relationship you're trying to get into about your most private secrets that some you don't even understand. Does that make sense?
Yes.
You got this, Sam.
Thank you. To care. My name is Edward McDonald.
And I'm seeing you a lot on television.
That's not me, that's my cousin.
You sound like that Shaggy song. Well, first I want to say kudos to everybody who put this together, because this is wonderful.
Yes.
To be able to have this. It's a historic moment. If you don't know it, it is. And I've been with HIV since '86. I've had HIV. Also had cancer 3 times in my life. Even breast cancer, which I didn't even think I could have that, but I did. So, and I'm in remission in all 3 of the cancers. Breast, and I've had, and HIV was standing by the wayside in the back, waiting, say, I'm still here. But you know, my question is, how do you guys, do you think of ways that can help us as clients be more empowered and be more knowledgeable? Because I'm a retired librarian, so I'm all about that. And so that we can ask the right questions for our health care, and we can get the most out of our health care. You know, how it's a responsibility on both sides. It's not just what you guys being experts, it's what we have to do too. We have a responsibility. So this whole segment of this first part here about being empowered to know what it is you need or want or how to get it. You know, do you guys think about ways that you can teach us to be better patients or better knowledge people to get what we need to get our health care?
Well, I think it starts as far as doing stuff like this.
Yeah.
Like just this. But I mean, as a patient, I think reading and just
Okay.
asking questions, because we go to school a long time to be able to read research articles and understand it and process it. So it's not something you learn right away. So it takes time. But I think reading articles and legislation that comes out about your healthcare helps you understand what you are entitled to, essentially, what your health insurance lets you do. Because while we seem to be the powers that be, insurance companies tend to make a lot of powers that be decisions behind us. So yes, so knowing what you're entitled to and what you can do helps us help you. So I think understanding that and reading, and then when you don't understand, we're your resource. Like, hey, I read this article, this research, can you explain to me what this means? Because we don't know every research article, we don't know everything, so it's very possible you may bring something to us that we have not read, which is the relationship component. Like, we don't know everything, and we're in a position where I'm comfortable saying I don't know everything about healthcare. I am practicing, which is where the title comes from. I am learning and growing and evolving in healthcare just like you, so you bring it to me, I'm gonna read it, and we can grow and say, hey, this is great, this may be for you, this may not be for you, but you have to read it first and then bring it to me, and we can grow together. So I think just the reading.
And can I add something? 2 things. There's a person standing behind you, Mr. Edward, Brother Kwame, who I'm not going to talk about him because I have a tendency of elevating people. He will be on a panel later to talk about the work that he's doing, but the creative genius that young people have these days is amazing. Yes. Brother Kwame is about to transform healthcare from a very technological, accessible atmosphere, specifically for Black people. So first and foremost, everybody in this room talk to Kwame. Raise your hand so they can see. Yep. Got to talk to him. Second, I would say, and I had to learn this recently, that your provider is a human being.
Yes.
And sometimes we forget. The person over on the end said that she's not Jesus, she doesn't play him on TV, she's not trying to fix your whole life.
Right.
But a lot of times, we are mean and nasty. We can be some evil people. When you in pain, When this is your 4th appointment, you might go in there with a very visceral reaction just to the person who you checked in with, right? And then you forget that they have feelings, that they have emotions, that your doctor, even though they respond to all of your messages on the app, doesn't mean that they don't have anything else to do. Yes, I'm putting myself out there, right? Being able to humanize your provider. And then, really expecting good intent.
Okay.
Right? That their intent is not to harm you.
You wouldn't be a doctor if you...
That their intent may not be, and sometimes they can be so caught up in everything else. Don't forget, they're going to see someone before you came in there, and they're going to see someone after you. If they work in managed care, like a lot of the people here, they have time limits. Right? It's not that they want to rush you off, but sometimes they have to. So I would say really focusing on humanizing the experiences of the person you're talking to and ensuring that you let them know that I know that you have my best interest at heart. I know you want the best for me, but I'm scared right now. And this is why I'm scared, because I'm not getting the answers that I thought I needed. And I can't really read because 4 and 5 syllable words don't gel with me. So maybe I'm going to talk it in my phone. Right? So this is what I want to ask you about today, and then I'm going to play it for you, right? Same like what Doc just said. But being able to humanize your provider and not coming in with the expectation that as soon as you sit down, they're going to be able to do everything for you.
So Kaita just brought it really home. And my job, I make things real simple because I had to do things myself. I am Mr. Lost 30, 40 pounds, training for an ultra marathon, but recently got put on blood pressure medication because of stress. Unexpected deaths in my family, the stress of people pulling on me all the time. My blood pressure was 160.
And you want to fix the world too.
Right? Oh yeah. Blood pressure was 160 over 111. And for no other reason, it's stress. So I started doing the meditating. I was told to sit down and think.
Which is stressful.
Sitting down and thinking. You just mentioned if you can't, all the questions that you might have about your healthcare, you write them down. I don't understand that. I don't understand it, so you're prepared. That doesn't make any sense to me. Talk it in your phone, and then you go, look, before we get started, what does this mean? And how does this relate to this? Now, I'm diabetic, but you keep telling me to take a yoga class. I don't understand, how does that work? Correlate. Write down the questions in your terms and discuss it. It's a relationship. And believe it or not, your doctors, your healthcare providers will appreciate that.
Yes. Yeah. Helps us direct the appointment. It helps us know where we're going.
I agree with this, and she brought up a point about like being on the app. I think that, a lot of healthcare facilities now have different apps and portals that you can get on, and I think, there may not be things that you understand, but you should try your best to get to learn more about your own health care. Look through the app. Oh, my ultrasound showed this. What does that mean? My lab showed that. It says high, it says low. Is that okay for me? Is that, should I be concerned about it? So I think one way to empower yourself is to really access your own medical records, kind of go through them yourself and, ask questions about that. And make sure that, you kind of told us a little bit about your history. You might have a doctor here, doctor here, doctor here, just making sure that they're all coordinating your care and, so, you could be the leader of the pack.
Yes.
So, I think that's.
And continue to ask your questions when you come into the office, because a lot of people in the community, they speak to family members, right? So I had a 30-year-old come in and their grandfather was diagnosed with prostate cancer. So he just wanted to know, will I be checked for prostate cancer because my grandfather had it? Listening to people in the family, finding out about your family history. What has been going on in your family, so that I can go to my doctor's office and ask them, hey, will this happen to me? Your history with cancer. Who else has cancer in the family? Your grandmother, your aunt, uncle, parents, stuff like that. Then come to the doctor's office and say, hey, what do I need to be tested for to make sure that I don't get this type of cancer? Or just ask questions, any questions that you may have. A lot of people may not be able to read and write, so I understand that. So you may not write down your questions when you come into the doctor's office, but have something that you want to present or you want to talk about, as well as reading on your own if you can.
Yes.
You can read, go to various forums just like this, talk to other professionals, healthcare professionals. It could be your dentist. My dentist recommended my primary care provider to me, and that was the best thing that could have ever happened to me. Sometimes insurance agents, just various people that you may talk to just in your everyday life. Just be open. Be open, be ready to receive everything that you have. Ask questions. If you don't understand something, just with anybody, not just in healthcare in general, just ask questions.
And the other thing to remember, I want everyone to remember this. 80% of your health and your health status is due to environmental factors, things outside of your genes. Mama diabetic, daddy diabetic, I'm gonna be diabetic. No, you won't.
Nope.
You just have the genes that say if you flip that switch based on the way you interact with the world, it can go that way. 80% of our health, all of the recent studies show that 80% of all of our health is determined by how we interact with the world, which takes the stress off of us. Not what I'm gonna do, but what you gonna do about that, right?
Yeah.
So making the common sense decisions, the mother with the grandmother decision. I know I shouldn't be eating. I'm all the way in Paris. The first thing I went to look for was some Popeyes.
Not that deep. Not that, yeah.
I had to compare. It didn't taste the same, so that was good. But the onus was on me, right? My stomach got upset. It wasn't the doctor's fault. But 80%. So you are the key to your health, and you need to make sure that you understand you before you go to someone else to help you with you.
Yes.
Okay. Thank you very much.
I have a question for Dr. Gray. Not your twin. I watch you every morning. Yesterday morning, you said something about wine. Wine is not good for you. So what is the true answer? It's not good?
No, the
Good?
absolute truth, all of the studies are showing that no level of alcohol is good for us. However, we've been in relationships and we know wine happens to be one of those, alcohol happens to be one of those. The reason alcohol does the things that it does, one of the reasons why is when we drink alcohol, the body identifies it as a poison and it shuts down the rest of the shot. We're not processing sugar, we're gonna store it as fat. We're not gonna think, everything in the body is geared toward, let's get this alcohol out of us. Now, the beauty is, the body metabolizes it's about 1 drink an hour. So if you pace yourself, I have a blood alcohol, not that this is for demonstration purpose, but I have a blood alcohol concentration device on my phone to test my blood alcohol level. And what I found out is after 2 drinks, 2 rum and cokes, I'm over the legal limit. So I need to call Uber.
Those are singles.
See? What it tells me is, A, I either need to call an Uber, or B, I need to drink water. And I need to wait at least an hour for my alcohol, because there's nothing you can do to speed up alcohol. All these hangover cures, all that stuff, it doesn't work. Now what they found was, they were saying it's called the French paradox, because the French are healthier heart-wise than we are, because they drink a little wine with every meal. Now after being in other countries, they drink wine with almost every meal, but it's a family meal, it's family style, and the focus is not the alcohol or the food, it's the company. The company. So you can drink a little bit of wine, you can sip it, and be okay if you don't get drunk.
And most of us are like, I'm going to Trader Joe's and I'm going to drink the bottle. Give me my 2 buck chunk from Trader Joe's.
Safe allotment the studies are 2 drinks a day for men, 1 drink a day for women. But again, I get beat up. They call me Dr. Gretz. It's 1 drink, 1 water, 1 drink, 1 water. And they're like, Doc, what about you? I said, mind your business.
What about the coffee? Is the coffee help too?
So
It
does not help with alcohol. What happens is coffee gives you because of the caffeine, it gives you the facade of alertness and can get you in more trouble, because you're actually, all of the things, your dexterity and your ability to think, all that is still there. You just feel more awake about it.
false illusion.
Yep, it's a false illusion. Yeah. Does that make
Should you
sense?
take it with magnesium?
Yeah, because it's a toxin, but so is television sometimes.
Hello guys, quick question. What do you all say to people who just afraid to change healthcare providers because of the extended wait that it takes for them to actually see the physician?
I normally tell everyone, maximize all your resources, okay? Call your insurance companies, again, ask friends and families, go to other healthcare facilities, because you never know who you can see. Even though in that organization, there may be a list to see those providers, but in another organization, I do it all the time. I do it all the time with myself, and I do it all the time with my children. I always call around to see who is available that someone can see that's in my healthcare network, okay? So do not limit yourself to wanting to see another provider, because it is available. Your insurance company, on the back of your card, they should be able to give you 5 providers in your area. That's what you ask for when you call them, okay? So when they give you those 5 providers, you call them up, see when they have available times to see you, make sure they take your insurance, and if that fits you, then go see that provider. But don't put any limitations or any borders on yourself that you can't see someone else.
And don't discount the value of your barbershops, your beauty salon,
Yes.
your nail salon. You might run into a doctor, and you hear my story and be like, look, you know what? Come on, I'm gonna put you on the
I'm
phone.
gonna squeeze you in.
Yeah.
So you saying that we come and talk to y'all today, you like strong possibility somebody's gonna say, I'm gonna squeeze you in. Is that?
It depends on how good the story is.
I can't say that.
She said absolutely not.
I can't say that.
I said it depends on how good the story is.
Okay, so we're gonna wrap it up. They are starting a resource fair downstairs, so there's gonna be lunch provided. Your
What happened? Can't hear.
Ooh,
We're
lunch.
gonna start downstairs, but this portion is over, and then there's gonna be another panel later this afternoon.